Very pleased to welcome our expert panelists, Jenny Lynn Holmes from Catholic Charities and Jen Close from Generation Housing, also known as Gen H. We're going to structure our conversation around three big questions. First, trying to get a county-wide landscape view of housing and homelessness and what's changed over the past year. Then an individual organizational overview of how are folks responding to this changed environment. And then the third set of questions around the horizon, what's coming in the near term, both good and bad, that we need to keep our finger on the pulse. I think this is a conversation that is good news and bad news. The good news is we have made great progress as a community over the past 5 to 10 years, despite ongoing fires and floods and pandemic. The bad news is we still have a long way to go to ensure that everyone has an affordable home. And so as we start to look at this very complex issue, there's not just one solution to it, but rather suites of solutions. And so we're going to hear from folks today that offer many different perspectives on how we can continue to address housing and homelessness in our community. So let me pause here and also mention, if you have questions along the way, you can put those into the chat box. At the end of the conversation, we're going to try to leave at least 20 minutes for you all to ask questions of the panelists as well. So, Jenny Lynn, Jen, and Akash, thank you all for bringing forth your expertise to this conversation. Let me start with this first sort of big question around the county-wide landscape view. This is 10,000 feet looking at the forest. And what's the current state of affordable housing and homelessness in the county, particularly after this past year? Jenny Lynn, I'd like to start with you, and then Akash, maybe you could follow up second.
Great. Nothing like going first. Let me just thank you all for the opportunity to talk about what's been going on in the area of homelessness and housing, which are incredibly interlinked, as you'll probably hear as we talk. And I also just want to say what an impressive way to start a morning, hearing from your three bright young rising stars. And I'm hoping maybe future Catholic Charities employees, we do hire immigration attorneys and social workers, so just putting it out there. We're always recruiting bright new talent. So it was a great, refreshing way to start. So thank you for letting me be a part of that. So I'm going to start off a little bit with kind of homelessness and what it looks like in our community. And I'm going to give you a really quick and fast, there's like a million more data points I could, but I'll try to give you the most important pieces. So as many of you know, we do an annual homeless count, and that really gives us the data to understand how we're moving the needle or not around the issue of homelessness in Sonoma County. And so, as you can imagine, homelessness is a national crisis, but I don't think it's any more, it's probably the most prevalent here in California, and definitely the Bay Area and Southern California are kind of the biggest hotspots of homelessness in the nation. So we've got a lot of work to do, but it's also a great area of innovation that we've been actually setting some trends for the rest of the nation, which they're starting to follow. And I'll talk about some of those ideas. So just some data, on any given night in Sonoma County, there's about 2,800 individuals experiencing homelessness. Of those 2,800 individuals, 60% of them are unsheltered. So a great majority of our homeless population are literally living on our streets, on our hillsides, under our underpasses, with no shelter to protect them from the elements and from other sorts of horrible issues that sometimes occur on the streets. Now, with that, those are some not so fun numbers, but I'll also say here in Sonoma County, we've actually reduced homelessness by over 40% since 2011. So we have actually proven some local strategies that work. What we need is the right level of investment of resources, and we need to really take those strategies and double and triple down on them. And sometimes we'll talk a little bit about the politics of homelessness and how sometimes it's taking us offline from the things we have proven to work here in our community. And so that's really been my focus, is trying to find the evidence-based, research-backed programs that'll really make a dent on the issue of homelessness. Now, when we look at the area of homelessness, when we actually talked to the individuals here, we found out that 88% of the people who lived here, who were homeless, lived here in Sonoma County before they became homeless. And of those 88%, 64% lived here for 10 years or more. So when we're talking about our homeless population, we're talking about our community members, our neighbors, our citizens. And sometimes it's hard to remember and think that these are people who may have grown up in our community that have now hit a major crisis that has led them into the issue of homelessness. One last thing I'll talk quickly about just with the data around this issue, and then kind of paint the last piece of the picture is, we have subpopulations in the area of homelessness. We look at homeless veterans. We look at families experiencing homelessness, youth experiencing homelessness, so on and so forth, chronically homeless, which is our most prevalent and pressing issue. And I will say we've actually made some progress in those areas other than one subpopulation, which is our older adult population. In the last year, we actually saw a 42% increase in the older adult population of individuals experiencing homelessness. And of those individuals, 22% had experienced homelessness on and off for about 30 years. So we have a problem with people and individuals experiencing homelessness for a very long period of time, and we haven't been able to find the right intervention for them yet. And Akash is going to talk about the Palms Inn. That's probably the most significant thing we've done for that part of our population that has been homeless for such an extended period of time. And that's really where the focus, in my opinion, needs to be, because the public perception of homelessness is definitely that it hasn't decreased in our community. In fact, many people think it's increased despite the data that shows otherwise. But the reason why that's the case is because the population that we haven't been able to really move the needle on is our unsheltered population. And that's where we need to spend our time and attention in the next few years, not only to help those people because they are the most likely to die, but also to help our community. As there are negative side effects in our economy, our downtown businesses, so on and so forth, when we look at the area of homelessness. So that's an important strategy we're really focusing on. And the thing that I just want to kind of say is we're really trying to move the advocacy and the understanding of the issue of homelessness from not just managing it, but solving it. When I talk about managing homelessness, it's oftentimes people are like, well, let's start these programs that give them a place to be at that moment. And those are helpful, but if it's not linked to housing, all we're doing is managing people in place, and we're not actually solving them and giving them the right to housing that I believe every person in our world deserves. And so if we're not also linking the homelessness with the housing conversation, we're not solving it. We're just managing it and doing it in an expensive way. And so one of the things that is really important for us to be talking to people about is that we need all forms of housing, market rate housing, affordable housing, permanent supportive housing that Akash is going to talk a little bit more about. But we also know that every time we create one, what we call shelter bed or interim housing bed, we need to create 3 to 4 housing beds. Because if you don't have that pathway out of that shelter bed, you're just going to have that person moving from place to place to place until they eventually get frustrated, give up, and then typically become our unsheltered population. So that's our focus, is really linking this housing and homelessness solution and making sure that not only that we have the housing, but we have the right supportive services in place to make sure that they stay housed. Because one of the worst things we could do is put someone who's been homeless for 30 years into a house with no support, no care, and expect them to be successful. And that's a lot of what we've learned at the Palms Inn, which I'll let Akash tell that story a little bit more. So I'll turn it over to Akash. I have lots more to say, but we'll have time.
Thanks, Jenny Lynn. Akash, you've created permanent supportive housing for more than 100 people, homeless and veterans, at the Palms Inn. And so very eager to hear your perspectives about housing and homelessness in our county, particularly over the past year.
Yeah, definitely. Thank you. Well, I first want to say that the Palms wouldn't have become a reality without Jenny Lynn and Jen Close, actually. It was just an idea, and really Jenny Lynn pushed it and Jen to become a reality. So they have a huge, I have a huge amount of gratitude to the two of them. So as Jenny Lynn was saying, so the Palms is 104 units. It's a hotel that I converted into permanent supportive housing. And so with that intervention, it's the average chronically homeless individual costs our community between $80,000 and $180,000 per year living on the street. And that's in law enforcement interaction, jail, hospitalization, emergency room visits, and the average, and it costs our community $13,000 per person per year to house them at the Palms in that permanent supportive housing. So the return on the investment as a community is incredible. Not only kind of, as Jenny Lynn was saying, the right to housing, and the reality is that we can't let our neighbors live on the street without any kind of services and support. One of the issues, and kind of Jenny Lynn touched on it, is like having the right housing intervention for the right population. As we were talking about, you know, our chronically homeless population, you have to think like these are the individuals who literally fell through every safety net that we have as a community. And so that like resistance towards services is completely valid, right? Like there's these individuals literally got let down at every single level of a safety net that we should have as a community. And so what we've realized, you know, with that, especially with that extremely vulnerable, like literally we at the Palms, we took the most likely to die on the street and house them with all the supportive services. And as Jenny Lynn also said, like there's the only thing that makes housing a vulnerable population sustainable is having an incredibly robust level of services on site 24/7 to help facilitate life skills and kind of that organic transitional phase for when that individual can come develop the life skills and then organically move on when they see like they're able to do so. And so, and as any complex social issue, it's really, we have to look at it holistically. And so as you know, the combination of homelessness and housing, we see the same situation at the Palms, where we have taken an individual who is incredibly vulnerable off the street into housing, and as they develop life skills and they can theoretically organically transition out, that link to go out into the market is not there for that individual. So just as Jenny Lynn was saying, like having, you know, we need to have three units of housing for every shelter bed. We have the same situation at the Palms, that if we don't have enough housing as a market in our community, then even our individuals who have developed the life skills and who can organically transition out of the Palms into the community to open up that unit at the Palms for the next person, they don't have the ability to do so. And so it's a huge challenge.
Thanks, Akash. I think you're hearing folks around this steps that it takes to move folks through a housing scenario, and that each step is slightly different based on the population. Jen, I'd love to hear your thoughts on from Generation Housing, a major startup advocacy organization that the Community Foundation has invested in over the past several years. And what's the housing landscape look from your perspective?
Thanks, John, and good morning, everybody. I have all of a sudden unstable internet, so let me know if you're not hearing me, and I'll try to switch connections. But I appreciate how this is set up, talking about homelessness, and then also an example of permanent supportive housing, how to move people out of that, and now talking about the greater housing need, because it is a housing ecosystem that needs to be looked at in that way. At Generation Housing, and John is right, the Community Foundation helped launch us and has helped us grow as a startup. And so we're grateful for that, and I think the community is grateful for that. But we're about to release a report about our overall housing need in the county, because there are lots of questions about exactly how much housing we need, and there have been numbers thrown around for the past couple of years or since the 2017 wildfires. But there hasn't been an actual specific study, and so we just completed that, and our need shows that we are behind 38,000 housing units right now. And that we will need 20,000 more by 2030. So that's 58,000 housing units. And that's a number that probably will make people gasp and might be a little punch in the gut for some. But we're really trying to put it in perspective of, number one, we can achieve that by building at the same rate we built in the 80s, and building at the same rate that they're building in lots of communities like Boise and in many communities in Colorado and South Carolina. This is happening places. And the other thing is that it actually is pretty in line with what our general plan build out provides for. Our general plan build out right now, using the infrastructure we have now, says that we as a county can accommodate another 52,000 units. So if we can just multiply our housing production by 6, then we can get there. And I think that the staff and elected level in housing in this county have the same goals and are I think we have a political environment that is right for this, so long as we continue to push and support our electeds and our staff leaders in the housing front. But we've got a big challenge ahead of us, and one thing that is critical, and actually Pete Golis wrote a column about this a couple of months ago that sort of took the words right out of my mouth, is that, you know, right before the pandemic, you could be at any meeting about anything with anyone, convened for any reason, and you'd end up talking about housing. And then there was the pandemic, and we obviously and necessarily switched our conversation to direct services around the pandemic. And now we've sort of got to bring housing back to the top of the list, because it is so interconnected with the health in the broadest sense of our community. So our housing deficit, it most significantly impacts our communities of color. They're 4 times more likely to be struggling in with respect to their cost burden, meaning they pay more than 30% of their income on housing costs. And that's something that people talk a lot about. They say housing costs too much and people have a cost burden. And we, in fact, in Sonoma County have the highest percentage cost burden individuals in the entire Bay Area, including San Francisco. But I think what people don't talk about, and what we're trying to talk about more, is what does that mean? You know, that means that you're not paying for healthy food, or you are not paying for dental care, or you are not paying for educational enrichment or support, or you're working 2 jobs. And so you can't be present for your kids in the way that you should be, and you're putting yourself in an unhealthy situation, or you're living in an overcrowded household. And we have 10% of our community are living in overcrowded households. Our Latino population is 10 times more likely to live in an overcrowded house. And we saw that play out tragically during the pandemic, where we had a high proportion of COVID transmission cases lay with the Latino population, even though they're only 27% of our population. And that's really directly related to overcrowding. And that isn't always, that the pandemic shines the light on that, but it's always the case that it's an unhealthy environment. We just see it right now. It's much more obvious. So that I think I'll end there. John asked me to be succinct, so I think that's our view of sort of what's that housing need, and let you move on.
Thanks, Jen. So that's the 10,000-foot view of the forest from these 3 folks. Now I'd like to get down to the ground and talk about the individual trees in the forest. So I'm hoping the 3 of you can talk a little bit about your organization and its current work, particularly as it's responding to this changing environment. Akash, I'll begin with you and then follow with Jen.
Yeah, definitely. So as I mentioned before, like seeing the incredible need for a place for people to organically transition from the palms into the market, my next plan is to actually build more units on site at the palms, essentially to create like a continuum of housing on the same site. So when we take an individual directly off the street, as they develop those life skills, they have a place and they can see a place where they can organically transition into, so you're not living in a converted hotel room, but you have a full studio or 1 bedroom with the full kitchen, and yet you're still able to have access to all of the supportive services that are at the Palms because of Catholic Charities being there and the VA as well for the veterans. That's my huge goal now, to actually see that into fruition, because there's a huge, incredible need to have essentially that apartment on training wheels, where when an individual comes into the Palms, they have interactions with their case managers at least once a week. Most of them, our high vulnerable population, as multiple times a week. And as they develop those life skills and that income, because for the veterans, our veterans, their income increases by 30% on average within the first year of their housing. So they come in, they develop those life skills and that income, and then for them to be able to have a place where they can organically transition out of the really intensive supportive services aspect of the POMS into what we're calling right now POMS 2, slightly less intensive supportive services, yet still all around the overall program support that is at the POMS. That's a huge need. And another thing that Jenny Lynn kind of touched on it, but one of the big issues that we see is that the housing aspect for the veterans are a specific voucher. It's a VASH voucher. And with those vouchers comes the funding from the federal government for those supportive services for the veterans. And yet we don't have that voucher avenue for the civilians. So that's a huge challenge. And I'm sure Jenny Lynn will talk about that, is like really having to bring support around creating a sustainable financing for the supported services, because as I said before, we've all said is like that is literally the only thing that makes these projects sustainable, is the supported services.
Mm-hmm. Thanks, Akash. Jen, you talked a little bit about the research that your organization has been doing the past year, and I think you're going to share the link for the research report at the end of our conversation today in case board members want to dive into that. But tell us a little bit more about how your organization is responding individually.
Thanks, John. And we might be sharing that link, but we might not.
Okay.
We are dedicated to having typo-free work and also everything translated. And we're right up to the wire on making sure that both of those things happen before you release. But we'll definitely send it directly to you so you can pass it on to the board if we don't get it by the end of this meeting. We have been in the past year doing everything we can to move policy forward that will help accelerate housing production, to generate or to help identify financing sources that will help make projects pencil here, which is hard in Sonoma County. It's just as expensive to build here and sometimes more expensive, a lot because of the policy problems we have or the bureaucracy slowdowns that we have. But the rents actually aren't as high. And so even though they might be high relative to income to create that cost burden I talked about, they're not high enough to make all projects pencil. So this financing is really important. And then of course, we've also just been building sort of the power of our organization. We can't be a strong advocacy organization unless we have a membership behind us. There can't just be a handful of us writing letters and still be impactful. So on the financing side, we've put a lot of time and energy into making sure that Sonoma County got its fair share of wildfire tax credits. Affordable housing is financed by this incredibly complicated system that includes federal tax credits. And Congressman Thompson actually got an additional amount of tax credits for fire impacted areas, but as the regulations to allocate those came out, it looked like Sonoma County was going to get shorted significantly. And there's always a battle between sort of Southern California and just the bigger jurisdictions for tax credits. And so we really led the local charge to make sure we got our fair share, and we're successful in that. And that's going to be to the tune of about 1,000 more affordable housing, deed restricted forever affordable housing units. So that was great. There's also right now, we're actually doing the same advocacy again for a second round of affordable housing tax credits, where it won't be as significant, but maybe end up with the money to finance about 600 units. And so we're active in that, and just also creating a presence at that state level that we haven't had before. Sonoma County hasn't been in there sort of fighting for its fair share of tax credits, which are competitive. And so now we are gathering groups of people, and you go to these meetings virtually, of course, and instead of everybody being from Los Angeles, most people are from Sonoma County. And so we're really making a difference at that state level to pull down state dollars or federal dollars that we can get. We also spend a lot of time in advocating for the Renewal Enterprise District's housing fund, and that's actually also Community Foundation did some research that said that if we can create this local housing fund, it can help solve this developer math problem. And so that's another Community Foundation win. But it needed to be funded. It needed seed funding, and there was talk when we got PG&E settlement money of the city and the county putting in $1 million or a couple $1 million. But really, we needed 20 million to kick this off. And so Michelle Whitman, the ED, could have spent the next 5 years trying to seed it, or we could get a significant investment now. And so we really advocated hard at city and county level, and they stepped up and provided $20 million of seed funding, which should attract now a lot of capital from traditional funders and help provide a low interest local housing fund to get housing built. In the meantime, we have been, like I said, sort of building our organization's strength so that we can be strong in this advocacy realm, and building our membership and really educating people about housing and educating people about the interconnection between housing and all of our other quality of life issues, as well as our local economy and how we can really be, how home building can really be a driver of our economic recovery post-COVID. So we've been working hard on that and excited about sort of next steps going forward, the policies that we want to use our strength as an organization to pursue that will help get housing built and also get that done in an equitable and environmentally sound way.
Thanks. Jenny Lynn, would you like to add to that?
Yeah, I'll talk about a little bit what our organization has been doing. Some of it you may be following. Some of it's been in the news, but I'll just kind of say one of the things that we really doubled down on and maybe quadrupled down on is the focus on housing, especially when we were faced with this global pandemic and the risks that individuals experiencing homelessness have if contracting that. The likelihood for, there's studies done that the likelihood they would have 3 times more complications, 4 times more likely to die from it because of pre-existing conditions and other things that faced individuals experiencing homelessness. So our focus was to quadruple down on the housing. And we were actually, over the last couple of years, we've been able to triple our individuals that we have actually placed into permanent housing. Last year alone, we placed 864 people into permanent housing. And we do it through a variety of ways. Some of it is, putting them into market rate housing, but most of it comes from either master leasing units from landlords or actually direct leasing, but having an agreement that will kind of transition this individual, help support them in the home, and actually subsidize their rent for a period of time. We also changed the model of how we actually did the housing search with the individuals. We kind of hired social workers to work with these individuals, but as you might know, social work doesn't necessarily teach anything about real estate or anything like that. And so we actually created a team of housing locators that were professionals in the real estate community to go and network with our real estate, with our landlords, with our property management companies, and actually set aside units for Catholic Charities. Go in, work with them, speak their language, understand what they need, be a liaison between our social service side and the side of kind of what their needs are as well. So that has been a huge help for us to increase our housing placement rates. We also really looked at kind of interim kind of pathway to housing programs. One of them you may have heard about was the Sandman Hotel, where we actually took individuals at very high risk of complication from COVID-19, placed them in individual units, and actually case managed them in the home. In the hotel unit. The other big program we did over this last year was the Finley tent encampments. This wasn't necessarily for people at high risk, but this was to kind of create some social distancing in our encampments because they are very compacted, and we wanted to kind of provide a safer alternative. We have a lot of lessons learned from that site and that program, one of which was that it actually became more of a safe haven, not just from COVID-19, but actually a lot of individuals who have experienced violence and harassment on the streets. We had a lot of women who were escaping violent situations, sexual assault situations, and they felt safe being in the camp. And it was actually a place for them. We had 24/7 security and staffing and on-site medical services, on-site case management, and so on and so forth. And we were able, the other big learning was our outreach workers, which sometimes struggle to find individuals as they move throughout our city and our county, they knew where they were. So we were actually able to work with them, get them document ready, and get them onto the housing pathway for a lot of the individuals. So there was a lot of great lessons learned, and we're kind of taking those and now working on what the next version of that might look like. couple of other quick things that I'll kind of dive into, like help set up for the what's coming on the future. Our organization actually also reorganized one of our program divisions, and we have them heavily focused on the area of homelessness prevention, especially in light of the economic impact and the ripple effects of the pandemic we've been under. We knew, based on our understanding of the population, we knew that we were facing a future at risk of homeless population, and we wanted to get ahead of it. We didn't want to wait for it to happen to us. We wanted to set the systems up in place to be able to prevent that from ever happening. So we rearranged an entire one of our program divisions to kind of pool their resources and really focus in on the area of homelessness prevention. And we were just actually given a significant amount of funds from the county for its COVID-19 rental relief funds. So we're actually out there getting the money out. We're not only making sure people can catch up on their rent, but also helping to take care of our landlord community. Some of them, this is their main source of income. And some of the smaller landlords and so on and so forth, we want to make sure they aren't becoming financially and economically unstable coming out of this pandemic as well. So that's been our big focus. And then lastly, I'll just say, some of you may or may not know, if you are a homeless kind of advocacy nerd like I am, we kind of reset our governance structure. And I'll talk a little bit more about that at the end, but there is a huge opportunity through that and with where we're going to really see an impact on true regional collaboration and completely turning the system into a way that is focused, collaborative, and data-driven. So there's a lot of great excitement coming that way as well.
Thank you, Jenny Lynn. I'm going to ask my third question here about the horizon, and then board members and guests, we encourage you to also prepare questions and put those in the chat if you'd like. Jen, you've talked about the redevelopment enterprise district and the new $20 million financing fund. I believe that was $10 million each from the county and the city of Santa Rosa from their PG&E settlement. Correct me if I'm wrong. But I know there's lots of other sort of opportunities on this horizon. The federal stimulus funding, a number of capital projects coming online. So give us the view of the horizon over the next year or half about what you're anticipating and anything that you're concerned about.
Great, thanks. I think we have to just keep doing more of the same, and that means showing up and advocating at the local level to make sure that good projects get through and are not hung up at design review boards or planning commissions, and that's something that we are trying to create more of a presence at, so that there is some accountability and some pressure to not slow down progress. Slowing projects means making them more expensive, and we need the housing now. We need them to be affordable, and the more expensive they are for the developer, the more expensive they're going to be ultimately for the renter or the owner. So we need to continue doing that and really galvanizing the public to be involved in that, as well as we need to push new policy that is going to accelerate housing, as well as create housing opportunities in good areas. And when I say good areas, I mean we need to have affordable housing not centered in one area of town, which just is going to exacerbate the already existing segregation that we see in our jurisdictions. But we need to put affordable housing in high resource areas in all areas. We need to build housing that is next to transit and next to jobs. We need to focus on multifamily housing, which is more efficient to build, which is can respect our urban growth boundaries and is good for our climate. It's great for water usage. So we need to push policy that encourages that. We also are going to really start focusing, like other cities and states, even in the country, on getting our jurisdictions to end exclusionary zoning. We have had in our communities everywhere in the country, exclusionary zoning that zones places only for single family homes that were started very specifically in a way that that was race-based, and it has continued to be maybe not racist in intention, but racist in its application. It's one of the things that continues to maintain segregation in our cities, and our cities in Santa in Sonoma County are high on the segregation list in California. And it is not a healthy way to build a community. So we want to, like Berkeley, like Sacramento, like Portland, like Minneapolis, move towards ending exclusionary zoning. And that doesn't mean you can't build single family homes. Portland got rid of exclusionary zoning and said you can build duplexes and triplexes and quads in your on your same lot that was formerly zoned for single family homes only. And since then, there has been increased development, but about 25% of those homes have been single family homes. So it doesn't mean you can't build a single family home, but it opens up options for more and increases sort of the organic development in addition to big multifamily housing and affordable housing. So that's something that we're going to really focus on are those policies. We also, like you said, there are federal stimulus dollars. And we definitely want to make sure that many of those are focused on housing, and they can be focused on housing in different ways. They can be grants or low interest loans for affordable housing. We think that that's a great place for them, and we're advocating for many of those dollars to be set aside for that. The other thing that that I'm trying to work on with Congressman Thompson's office and Factory OS, which is a modular factory on Mare Island. Is to help invest in Factory OS so that they can expand their output, but specifically benefiting the counties in the North Bay that are most in need, and Sonoma County is at top of that list. So working on that, as well as talking to cities about the kind of nuts and bolts policy that we can do, policy changes that we can do to accelerate building, and that's around how long does it take to do permit review? How long does it take to do plan check? How long does it take to get these projects ready to go, and not just the entitlement process, but then actually shovels in the ground and keys in hands by using pre-approved designs, for example, particularly when we can use modular housing. Modular housing isn't a total answer for all of this, but it can be and really needs to be part of the solution. So there are lots of opportunities there. We definitely want to keep focused on investing in the Renewal Enterprise District Housing Fund. That's going to be important. That can be a super powerful tool. We got to do that. And one of the ways also that we are trying to improve our voice or increase our voice and power is to really engage young people. Young people are right now afraid that they're going to have to move, or they are moving from Sonoma County because they just can't afford it and they don't see a future here as a homeowner. So we're trying to engage and educate young people on how to get involved and bring their voice to our policymakers who really do listen to young people. As an organization, we are a startup. We are not yet 2 years old, and so and we had great investment from Community Foundation and other early big founders. But we also have to focus on building a sustainable fund development structure so that we will be here for the long haul. Everybody's really happy that we're here. We sort of instantly started providing the actual programmatic work instead of spending time just kind of building our organization, because we knew there's an urgency and we've been working hard, but we have to sort of turn that excitement about our existence into a machine that sustains us financially for the future.
Thanks, Jen. Akash, what does the horizon look like in your near term?
Yeah, well, I kind of answered this a little bit as well, and I also apologize, my neighbor's doing some landscaping work, so you might hear some really loud machinery. He didn't know that we had this meeting today, so I can't blame him. But so I think as I said before, like the real future is in, and as Jen was talking about, is in the housing is looking at it as a holistic system. And so that means market rate housing, that means more permanent supportive housing, that means kind of this continuum of housing that I am seeing and envisioning on the Palms. So we can really give the individuals specifically experiencing homelessness the right intervention for them at that place, and have them have a trajectory to where they can go to then eventually kind of go into the market. And as I see, we have a huge issue with not having the right housing intervention for that individual at the moment. As the state did during COVID, Project Room Key, which was where the state's allocated a bunch of money for cities and counties to temporarily lease up motel rooms for people experiencing homelessness and having a higher probability of contracting COVID. They then pivoted that into Project Room Home Key, which was where they allocated a significant amount of money for cities and counties to purchase properties, similarly to what we did at the Palms to convert into permanent supportive housing. One issue or one potential issue I see with that, and kind of as I touched on earlier, is the ongoing funding for that supportive services, which is so incredibly important. The Project Home Key funding had included in it a time-limited amount of supplemental funding for the supportive services. So that's a concern I have just within our own county and other counties in the state of California, is how do they create a sustainable long-term funding? And because, as I said, with the funding for veterans, let's say, for different subpopulations is different levels of funding, and the veterans have a housing fund, but also the supportive services funding that comes along with it. We don't have that for civilians, which is what I feel like is a significant challenge to be able to create a long-term sustainable project.
Thanks, Akash. I think you're pointing out a big gap here in the funding that comes from government sources at the federal, state, and local level, that those funds come with strings. And sometimes it pays for the supportive services and the wraparound case management, but a lot of times it doesn't. And so helping folks to go through that continuum of housing means that case management is a place where private philanthropy can play a role, as an example.
Exactly.
Great. Jenny Lynn, let me turn to you on the horizon for homelessness.
Yeah, well, this one's a hard one for me because we're in a moment right now in Sonoma County with the issue of homelessness, and it's a very exciting moment. It's I'm not being overly optimistic there. We are on the tipping point of some really great things to come in the next year. I will be honest, I think over the last 1 to 2 years, we have struggled. We have in terms of kind of taking our homeless system of care to the next level. Part of it has to do with COVID. Part of it has to do with the complexity of this issue, the politics of this issue, the litigiousness of this issue, which is all separate whole conversations in themselves. But we are in a moment that I am feeling extremely rejuvenated and excited about. I've been doing this, working in the area of homelessness my entire career. And I'm seeing some things that are coming together that I've never seen happen in my entire life. So I'll kind of talk about a couple of them. Akash mentioned Project Home Key, which is it's a game changer. The governor's budget is putting several $1 million, actually billions of dollars, but millions of dollars, particularly into Home Key and also into ending family homelessness. As John mentioned, those things come with strings. It will help with the building of the housing or the conversion of the housing, but the actual magic and the secret sauce is really that supportive services in the home. If you're dealing with someone who's been homeless for 30 plus years and you put them in a home, they're going to end up back on the street for so many different reasons I could explain to you. And if we don't really deal with the root cause of the issue that brought them to homelessness in the first place, we're not fixing the system. We're putting a Band-Aid on it, and eventually we'll be dealing with these people again because we didn't really solve the issue of what happened in their life and the crisis that they came up against. The other really exciting thing is that our community is being given 278 emergency housing vouchers. This is the largest infusion of vouchers into our community for the entire time I've been in my career. And for those that don't know, it's kind of the Section 8 program. It's a voucher where it's actually, this is the most sustainable thing to help our lowest income, most vulnerable homeless population. We really have an opportunity with these vouchers, but they are limited. Just because someone gets a voucher doesn't mean a house comes with it. the individual has to find the house, and then the individual has to be able to retain the house once they get into the home. So while they're funding the actual leasing of these units in our community, what we are missing is how do we help navigate that person and help them find a house, kind of hold their hand through the process. And then once they get into the home, how do we case manage them and work with them in the home? There are some funds coming with some of those components, but it won't be enough to really deal with the whole 278 vouchers. But it is really exciting that this is coming and that we can actually use a systemic approach and even, look at different pots of funding to help us with really making sure we make an impact on our homelessness population with those funds. I mentioned earlier, we've kind of, our system coordination is kind of being elevated to a new level. We've got a new kind of governance structure that's really overseeing the system of care, and we're acting in a way that we had never acted before, or at least in my time. And we're really looking at regional collaboration. Homelessness doesn't know geographic boundaries, whether you're in Santa Rosa, Petaluma, Marin. We really, an individual's experiencing homelessness doesn't necessarily know when Santa Rosa stops and Roanoke Park begins. And so we need to look at this issue regionally, and we're actually kicking it off next week. We're embarking for the first time ever on a real strategic plan on how to end homelessness in our community. We've never really had that before. We've had kind of some versions of them, but they were a little bit more high level, but we're really going to dig into the weeds and really look at how we can create our system to better serve the population. A couple of other quick things I'll mention is we are close to ending homelessness for some of our subpopulations, families and veterans. We are on the brink that if we have the right infusion of resources, we could actually push it over the edge and actually get functional zero homelessness for families and veterans and a few other subpopulations. So we are really close, and they were actually working with some organizations to help us really plan more specifically, what do our families need? What do our veterans need? What do our chronically homeless need? And then I'll quickly talk about two programs. One you may have heard about is the CAHOOTS program. It's a program up in Eugene, Oregon, and it's kind of become nationally known in the discussions around police reform and racial equity and so on and so forth, and doing services differently from our emergency responders. We have been heavily working with the city of Santa Rosa to make this program a reality here in Sonoma County, in Santa Rosa particularly. And so what we're looking at is actually launching our own team. We don't have a name yet, so we're still calling it CAHOOTS. And this team will be a mobile crisis intervention team that will actually get dispatched through the emergency response system for nonviolent calls for service. And we will have on our kind of crisis intervention team a mental health clinician to deal with mental health crises, a homeless outreach specialist to deal with homeless care in the community, and we will also have a paramedic, so we can do field medicine and care for individuals in the field. So this will actually allow us to divert calls for service into the criminal justice system and divert calls for service into our hospitals and so on and so forth, which are extremely expensive. But more importantly, it's providing the right level of care for the person in the crisis. The police and our first responders have become the default to mental health calls, to homeless calls, and we really need to create a better intervention with the right people with the right expertise to really help that person. Because if not, we're putting them in the wrong criminal justice system, or putting them in the wrong, emergency care system, and that's not really serving their needs. So the Santa Rosa Police Department's been leading this effort, and we've been working with them, and we hope to launch that in October. And then I would be remiss if I didn't mention a little tiny thing called Caritas Village, which I think many of you are aware of. But Caritas Village is going to open in the next year. And this is kind of a game changer in a lot of different ways. We are dedicating an entire city block to ending homelessness. And that is just really amazing to say. We will have a state-of-the-art family shelter, an on-site medical health center, a drop-in center that really provides care and triage for the individuals coming in off of the streets. We'll have a medical respite shelter, and even more importantly, we will have 228 units of affordable housing going 4 stories high in our downtown Santa Rosa. So this is an example of how we really can look at this issue from the housing and homelessness lens. And we're really, really, really excited about that. And what we're really pivoting to is we've had a great success at being able to to get the construction up and running, to get the capital campaign done. And now we're pivoting to how are we going to operate this thing, and how are we going to make sure that we are providing the right level of staffing and operations into it. So that's kind of our strategic planning in that area, is diving into that with the hope that middle of next year, we will actually be opening our front doors. So that was a lot and not even everything, but we are in an exciting moment. So thank you.
Thanks, Jenny Lynn. I mean, I think board members can hear that there is just, an abundance of activity happening despite the pandemic and the resources coming here. Jenny Lynn, you also mentioned a collaborative that's called Continuum of Care here in the county, which brings together representatives from the cities, the county, and service providers in really a collaborative effort to look at housing and homelessness and the steps and continuum that it takes to help folks out. So did you mention they were doing strategic planning as well, Jenny?
Yeah, so the Continuum of Care is kind of our new governance structure. We've got representatives from different service provision fields, areas of expertise. We've got the county represented. We have different cities represented, elected officials. And really, this is kind of that group that we're really focusing on regional collaboration and kicking off our strategic planning. We need to look at homelessness from every different aspect. Homelessness affects everything, everywhere we go. It affects our businesses, it affects our downtown, it affects our criminal justice system, it affects our emergency response system. And if we're not thinking of things holistically and really looking at how we can solve it from all those different angles, we're not making an impact. So this is kind of bringing those groups together and saying, let's start tackling this issue together rather than our individual silos.
Thanks, Jenny Lynn. I'm going to pause now. You've had 45 minutes of dense talking about a very complex subject. So board members, what questions have come up for you as you're hearing about the issues of housing and homelessness? You can unmute yourself and ask a question, or drop it in the chat box, either way.
So this is Richard. I commend the incredible work and steps that are being taken. It seems like we do have some momentum. So my question is, really my question is around opposition to solution, and if you can define it, is there a commonality to that opposition or to the obstacles that perhaps we can help diffuse? So maybe a little talk about is it our nature to I don't know, maybe from your perspective, from the experts' perspectives. Thanks.
Yeah, I can try to start, but I definitely would love Jen's input, because I think that's the whole impetus of her organization and what we have found so valuable. But I think there's several areas of maybe opposition or barriers that I struggle with in the community. The first is a lack of knowledge and understanding of this issue. People think they have that. If there's an easy solution, if there was an easy solution to homelessness, we would have figured it out by now. This is one of I argue, the most complex social issues in our nation, because we have so many other pieces that are competing within the issue of mental health, substance abuse, so on and so forth. And so people want to find the easy fix, and there is no easy fix. This issue is complex, and these are human beings and with complex crisis and background. So people want to oversimplify it at times, and not understanding the complexity of the issue, I think, is one thing I'm constantly coming up against. And really the data, we do have some data. People have their perceptions around the issue, but when you look at the data, sometimes it tells a different story. And I think with that comes the political nature of this issue. This issue has gotten very, very political over the years. It is, I am copied, and constantly, I could say one thing in one group and I could be cheered and applauded, and I could say something in another group and I could have had death threats and fall to my car with threatening language. Like it is a very polarizing issue. And so we've got to come together and really take the politics out of it and start looking at the evidence and what really works. And then when we look at projects that we're trying to start, what's commonly referred to as NIMBYism is huge. And that's where I think Generation H has just been a huge advantage in our community, is educating people and helping to really advocate for the housing and combat the negative narrative that there is around affordable housing. If it's done right, we see things, we see crime, we see issues in that neighborhood actually go down. The Palms Inn is a great example of that. We actually saw those things happen. So those are some of the things off the top of my head with that.
And Jen, punting the ball to you and the public will building campaign, perhaps you could talk about.
Yeah, thanks, John, and thanks, Jenny Lynn. And really, thanks, Richard, for the question. I think it's really important to know what the opposition stems from. And part of it is, I think, just exactly what Jenny Lynn said, but on the development side, a fear of becoming a kind of community that is not the Sonoma County that people know, that we become a sprawling community like San Jose, or that we become a very, very dense urban community, and we sort of lose our character. And so I think that is something that we have to combat. There are people who think that it will be bad for our environment to build, or that we'll lose our open space, and that again is sort of a myth that we need to do some busting on. In fact, it will be better for our environment. We can make progress against climate change with the right kind of development. And then I think there is when we saw it sort of like specifically with the SAY Dream Center, we've seen it with Caritas, we've seen it just recently with a project called Stony Point Flats out on off Stony Point Road, where there is, I think, a fear of people who are different from them, and people who are lower income from them. And there's a fear that that multifamily housing will make property values go down, that duplexes and triplexes, that sort of missing middle housing will make property values go down, or increase crime, or negatively impact schools. But the data actually doesn't support any of those fears. The fears are real, certainly, but the data doesn't support those. And so we have to start really educating folks, and so that's really the focus of our public will building campaign, which we started a few months ago. And you might have seen things on the Roanoke Park billboard or lawn signs. Actually, we're supposed to call them yard signs, not lawn signs anymore, or in the Press Democrat, that say some very basic messages that we think everyone can agree with, that say, my sister needs an affordable place to call home, or all generations need affordable places to live, our servers, the people that we rely on in our day-to-day, need affordable places to live, first responders, home healthcare workers, childcare workers. And so we are trying to get people thinking about housing as it relates to people instead of building and construction. And our next phases of that campaign will be to specifically do myth busting around environment, so that we can say, yes, you can protect and preserve your open spaces and your local environment, and make some progress in our battle against climate change by the right kind of development, and that diverse neighborhoods make healthy communities. It's good for us to diversify neighborhoods. It's good for us to have multifamily housing, and that affordable housing are not scary tenement buildings. For affordable housing right now, it has to be built to a higher standard than market rate housing. And it's expensive to build. It's around $750,000 for a unit. And that's when I'm pitching investment in generation housing. I say, we've advocated for 2,000 units so far that have been entitled and are getting built. And each of those units is going to cost about $750,000. But that's around our annual budget. So we're a good investment. We can really leverage our work. But I think that's, the opposition is there, Richard, and it's about really changing hearts and minds and getting folks to face their fears. And it's also about, there are going to be people who are going to oppose things, and folks show up to say no very commonly, but folks don't necessarily show up to say yes. So the people who are pro-housing are the people that we can move to a more pro-housing position. We need to then get them to take that next step to come up and say, yes, we support this, and to give our policymakers a new view on that, or political cover for their pro-housing view. I think that was a really long answer. Sorry about that, but it's a big question.
Yeah, and Carol Beatty has also asked, what were the success factors for Boise and the Colorado cities? Was it available land and philanthropy, or sort of what were the mix of success factors for those other towns?
That is such a great question, and it's different everywhere. And we're actually going to put together a little document soon, so kind of stay tuned for that talks about that. But it generally is around, and it's kind of like what Jenny Lynn was talking around, our response to homelessness, is a community changed mindset, because there are several different factors. There needs to be, philanthropic investment in organizations that help push housing like ours, our philanthropic investment that seed that seed housing funds. There needs to be public policy changes that help expedite the process or reduce fees. Right now, 10% of every unit goes to fees when you're building. And so I think in each one of those communities, what there was sort of a community shift mindset that said, we've got to build multifamily housing because many things happened and changed at once. But to give you what we are working on, kind of, it's different everywhere, on something that says what led to that community mindset change. But it's happening in lots of places, and it's has to be multifaceted and cross-sector, and that's, I think, was part of the genius in the consultant that helped incubate Generation Housing, and part of our focus constantly is that we are trying to, I'm a lawyer who then was on that school board and came to housing through wearing my education hat, and got passionate about this because it touches everything. And so one of the things we try to do is convene our cross-sector leaders, and when we go speak places, we get people from health, and we get people from education, and we get people from economy. So I think that is the key everywhere, is that there is a community-wide mindset change.
Thanks, Jen. Akash, did you want to add anything around obstacles, opposition, barriers?
Yeah, just briefly, because I'm also on the planning commission for the city of Santa Rosa. So when we do get opposition, they come and really loudly to the planning commission. So, but to Richard's question, I think honestly, on a fundamental level, it's an emotional response, and that's what I've realized. Even when you talk about like the Palms or homelessness or even affordable housing, it's really coming from a place of emotion. And I think the biggest thing that we can do as a community, and obviously that's literally what Gen H is doing, is through education and really shifting that, redirecting that emotional response to saying, like, instead of being like, oh, I'm afraid of what's going to happen when this affordable housing is built, or when this permanent supportive housing is occupied, really shifting it to being like, where is my sister going to live, or my son who's estranged and living on the street, how is he going to survive? Like shifting that emotional response into something that will be supportive instead of in opposition is huge. And then I also think just having people obviously come out to speak on behalf of projects. That's the planning commission. It's for one controversial project, we'll have probably 50 people in opposition and maybe one who is for the project, supporting the project. So that's and oftentimes like having people to have that political cover is important to get things done, really.
Akash, Jenny Lynn, and Jen, thank you all for sharing your expertise with us this morning. Really stuffed an hour full of knowledge. And for board members,